This year changed endocrinology. In 2025, diabetes care became more weight-focused, obesity treatment became more accessible, thyroid cancer care became safer, and equity finally moved from theory into guidelines. This is the 2025 Endocrine Year in Review. I'll walk you through the biggest breakthroughs in diabetes, obesity, thyroid, adrenal, pituitary, and where endocrine care is heading next. If you want evidence-based updates without the jargon, you're in the right place. Let's start with the biggest headline of the year. 2025 officially marked the GLP-1 era. For the first time, GLP-1 receptor agonists and dual incretin therapies were recognized as essential medicines worldwide. Medications like semaglutide, liraglutide, dulaglutide, and tirzepatide were added to the World Health Organization's essential medicines list. That matters because it sends a clear message. These medications are not cosmetic, they are core metabolic treatments for type 2 diabetes and obesity. But 2025 wasn't just about access, it was about outcomes. New data showed that GLP-1-based therapies do more than lower blood sugar or reduce weight. They protect organs. The FLOW trial showed that semaglutide reduced kidney disease progression and major kidney events in people with type 2 diabetes and chronic kidney disease. And the SUMMIT trial showed that tirzepatide reduced major cardiovascular events and improved symptoms in people with obesity-related heart failure with preserved ejection fraction. So today, these medications are no longer just diabetes drugs or weight loss drugs. They are cardiorenal metabolic therapies. That's a fundamental shift. In 2025 and 2026, diabetes guidelines finally caught up to what clinicians and patients have known for years. The focus moved away from treat to failure and toward early personalized care. Key changes include earlier combination therapy instead of waiting years to intensify treatment, a weight-centric approach recognizing weight as a driver of insulin resistance and cardiovascular risk, and individualized A1C targets based on age, comorbidities, hypoglycemia risk, and patient priorities. Another major shift? Technology. Continuous glucose monitoring is no longer reserved only for people on intensive insulin therapy. Guidelines now support broader CGM access because seeing glucose trends changes behavior, improves outcomes, and empowers patients. Importantly, guidelines now openly address cost, access, and disparities. That honesty matters because treatment only works if patients can actually receive it. Technology continued to reshape endocrine care in 2025. Automated insulin delivery systems, also known as closed-loop systems, became more accurate, more intuitive, and easier to use. The result? Better time in range, less hypoglycemia, better quality of life. These systems are no longer experimental, they are becoming standard of care. Bariatric surgery also remains a powerful option for severe obesity and metabolic disease. Updated guidance emphasizes appropriate patient selection, long-term follow-up, and integration with medical therapy. The message is clear. This is not medications versus surgery. It's about using the right tool for the right patient at the right time. Thyroid care also saw a major shift in 2025, especially in thyroid cancer. New guidelines refined how we use TSH suppression therapy. For patients with low or intermediate risk differentiated thyroid cancer, who show no evidence of recurrence, long-term aggressive TSH suppression is no longer recommended. Instead, TSH targets should be periodically reassessed over time. Why does this matter? Because excessive suppression increases the risk of atrial fibrillation, bone loss, and fractures without improving outcomes in low-risk disease. This is a move towards safer survivorship care. For advanced thyroid cancers, updated recommendations expand the use of targeted therapies and immunotherapy, bringing precision medicine into routine practice. Pregnancy and reproductive endocrinology also saw important updates. For postpartum thyroiditis, new guidance recommends annual TSH monitoring even after apparent recovery. Why? Because a significant number of patients go on to develop permanent hypothyroidism. This is about long-term vigilance, not over-testing. Polycystic ovary syndrome, PCOS, is now approached as a lifelong cardiometabolic condition, not just a reproductive disorder. Care now emphasizes metabolic health, cardiovascular risk, and individualized management across the lifespan. Adrenal and pituitary disorders often fly under the radar, but not in 2025. New guidance strengthened the approach to primary aldosteronism, a common and underdiagnosed cause of secondary hypertension. Screening is emphasized, diagnostic accuracy is improved, and targeted treatment, medical or surgical, is prioritized. For pituitary tumors, updated consensus recommendations refined imaging and endocrine surveillance strategies for non-functioning adenomas. The goal is balance, early detection when needed, without unnecessary testing. Vitamin D guidance was also updated. New recommendations use grade-based evidence to clarify dosing, safety, and population-specific needs. Less hype, more science. Bone health remains a cornerstone of endocrine care, especially as our population ages. One of the most important themes of 2025 was health equity. Across endocrinology, there is now explicit focus on reducing disparities in diabetes and obesity care, expanding access to CGM and pharmacotherapy, addressing social determinants of health. Looking forward, the priorities are clear: precision medicine, digital health integration, long-term outcomes research, and care models that work in the real world, not just clinical trials. The 2025 Endocrine Year in Review marks a turning point. From reactive care to precision medicine, from isolated targets to whole person health, from access as an afterthought to access as a priority. If this video helped you understand where endocrine care is heading, please like, share, and subscribe, because better hormone care starts with better understanding.